Far beyond witches and wizards is the root cause of health problem of many in Africa. Seek professional advice concerning that your health matter.
Join Dr. Save a Life Foundation.
You and your health with Dr. Richard Okoye.
Great to have you here again in the studio, Dr. Richard Okoye, who is president, Dr. Save a Life Foundation. I'm completely excited that you found time to squeeze in to be here, even though you've got such a busy schedule. I understand that it's because of the passion in your heart that you've agreed to be here this morning. Thank you so much. Good morning.
Good morning. It's been quite exciting, honestly. You know, and the positive response of this has been quite tremendous, you know. And that's just the heartbeat. If we could be able to get the right orientation, thousands of lives will be saved, you know, because majority of the problem we have in this side of the world is basically ignorance, you know. So that's why I feel so excited to be here.
Great to have you here. Let's get to the issues. Now, like we've been saying all throughout the week and trying to drive the conversation and drive the tempo to this one moment, the conversation is going to generally be based around cardiovascular issues and the mystery behind sudden death and how we can, you know, uncover that. While we were doing this, somebody called me and said that they had an uncle who he said he was 56. But if I can't remember, I know you're listening. If I can't remember, please send me the chat again so I'll remember. I think he said 56 or something. And he said he just came back from playing lawn tennis. So he's very active, he's all of that. Played lawn tennis, came in, asked for his meal. And while he was sitting down there waiting for his meal to come, he died. He just slumped and died. And, you know,
Very pathetic.
yes, and then he said that it caused an escalation because it's a polygamous home. So there were a lot of people who were saying, oh, is that woman that did this because he got married? Or is this person that did it? And he says that has continued to haunt the family now. They've been unable to find a way they remain united because everybody's accusing each other of the one killing the breadwinner and trying to amass the wealth he left behind. And funny, when she was chatting me about this, I said it's synonymous with plenty homes I have heard of and I know of where somebody just slumps and dies and that's it. They said somebody somewhere has done this. They've called him or they've called her. Is there any medical explanation to this kind of things?
Before getting into the medical explanation, we must admit the fact that it is our way of life. It is our narrative, the way we say things in this side of the world. It's not just them just trying to ferment, you know, something of a problem regarding that enmity. It's the way we have been fashioned traditionally. And unfortunately also, it becomes our way of management of cases, prophetic utterances and order, all surrounding about what an enemy has done to you for which you suffer this. That's why you could hear people say today, your problem is not medical, your problem is spiritual, whereas you are a human being. So you now, when your problem becomes a spiritual problem as you have been converted, it becomes very difficult to manage. All right. So getting to that, the issue of sudden death is not something that started today. It's not something that is resident in Africa where demons are more. If
we go by the narrative here.
Go by the narrative where demons are more, in America, the commonest cause of sudden death in America is cardiovascular related, is heart attack, cardiac arrest. It's very, very common. And the fact remains that these things are right there. Even in the lives of our people, many people are having near-death syndrome as a matter of fact, but nobody cares. If I ask, the man that was late, when did he have his health check? It's not his portion. No, I'm hell and hearty.
Yeah, especially the fact that he said he just came back from playing lawn tennis. He's an active sports person.
Of course, we know about the former speaker of House of Assembly. Harry, you remember, he went to play lawn tennis. On the process is gone. A number of people also in the course of playing football, he seriously doesn't collapse and died. So it is not a function of the man who was hell and hearty. Looking at Kanu Nwankwo, for instance, a very, very peculiar case. Kanu Nwankwo was hell and hearty, as we could be able to describe him. He played for a number of clubs. Yeah. And then he went for a very hectic competition, which is Olympic 1996. And interestingly, it was all over jubilation and all that. And incidentally, he went into Inter Milan. On medical, they discovered that this young man had a heart defect, which never showed up all the while. So sometimes people have a latent health problem, but under an exertion, under increased activity, that thing that was a little bit quiet, managing the man that was maintaining a relative level of stress, if he's exposed to something extra, something that had been latent may also come up. That brings us to the issue that has to do with early dictation of those things could end up preventing. This
thing you said about early detection, I'll tell you something about it. I know a lot of people who have this knowledge, or who have this belief, let me put it that word, who have this belief that why do you want to go and detect something that is not there? Why do you want to go and diagnose something that is not, is not disturbing you right now? Because if you go to the hospital and you say, oh, help, I want to check, they will definitely find something. So why do you want to go and do that? Why don't you just remain as you are and not discover something that is wrong with you?
Interesting. 4 lepers came to a point in the journey of their lives. He said, if we remain here and I die, if we go back to the city, it's dead. The only thing that could give hope is that if we face this challenge, if we face this enemy, as they went ahead, God was able to also assist them, that they became rather a deliverer to a lot of people. This issue of sudden death, if you see some families, you find that in most of the cases, they hardly reach 70 years before they are gone. None of them will tend to find out, is there any genetic undertone to this? Is there any running problem in the family responsible for this? Simply because they've all held one enemy or one demon or one spiritual or one family deliverance that needed to be done. A middle-aged man came to see me one occasion. I look at the way he was panting. I said, my friend, you are going into heart failure.
Just by panting?
I saw that. I looked at his legs. And I said, can you check your BP? He checked his BP. His BP was 230, 110. And I say, my friend, look at your BP, you are in crisis. He said, no, I know. It's a poison. What they did, my father died of. And in fact, I asked him, where is your father? When he was trying to argue. I said, where is your father? He said, he's late. I said, what killed him? He tried to give a record of something, he came by sudden death, just like that. I said, the same thing that killed your father is already on you. Because if a child, as an adage, he said, if a child does not ask to know what killed his father will eventually kill him also. So the problem we have in this side of the world is that we don't have medical history. Most of the things that happen in family lineage, because the man died, nobody knew what was responsible. The children grew up having similar problem, and at the end of the day, the same story was told, is the same they will also tell. And that's why this is the time to change that narrative by, first of all, going to have a health assessment. Many of these things can be dictated. If it is hypertensive, okay, there's a family history of hypertension. Even some of them, they may have high blood pressure, have issue of diabetes. If you ask me, so nobody in my family, where is your dad? We don't know. Where about your ground? Did you take any? Because
No
no history.
No history.
So you assume I'm the only person. So if you are the only person, it's most likely to be an attack from an enemy. It has misled us so long. But the fact remains that if one is aging without going for health check, it's just like driving a car without dashboard. The day the oil finishes, it doesn't know. The day the water finishes, so engine can knock. And that's why it's so painful, and that's why we're carrying on this campaign to say it is time to change this Nigerian life expectancy of 55 years. That is possible to push it up to 70 by simple knowledge, knowing what to do. Prevention is better than cure, they say.
Let me just ask a brief question here. How important is early detection?
Of course, it cannot be overemphasized. When it has to do with, think about a Kanwanko situation.
Yes.
You're able to dictate that very whole. Even at that time, they told him it's an attack, it's a spiritual thing, that he shouldn't go, he should come either for miracle, which is not a bad thing anyway. But that thing was dictated and was closed. And do you know the interesting thing about Kano? In his time, there was an open surgery that was done. But today, to close that very hole
in the heart
does not require an open surgery anymore. Wow. It's an endoscopic closure right now. You could be in position even to replace the valve and all those things. Currently available in our own time, but people are not even aware simply because a mindset. As I'm talking to you now, there are people now somewhere dying and panting, being breathless, getting tired day by day. If you ask them what is responsible, they say it's a devil, it's an attack, and they have an enemy already existing, being responsible. And I ask a question which the church will help me begin to also ask. How come that all the people we are prophesied upon, we are telling that it's one devil or one demon? Why is it that majority of them end up dying? Has that devil become this very powerful? In a manner that all the prayers has become impotent? Simple thing. The Lord said that ye pray and did not receive. Not because you didn't express your so-called faith towards what you prayed, but because you pray out of point. One occasion when I was in teaching hospital, it happened to be a young man. And this young man had a kidney failure.
Okay.
Almost, there was no money to do dialysis, let alone going for kidney transplant. So they were just managing him conservatively. And a group of believers, maybe from his church, came and prayed for this young man. I was in the consulting room. They rounded him up and was praying, but I listened. That every demon in this and out, every marine spirit, all manner of spirit and attack, it sounded fervent. If you hear it from coming, you find out that their heart was connected to whatever they're doing. But soon after they finished surrounding the young man praying, as they've not gone out of the gate of their emergency room, the young man died. So they were called by, when they did this, immediately they called their attention, and when every resuscitation exercise failed, that young man died. Tell me, what will be the fate of their faith?
That they prayed for him as much as they did, and he died.
Nothing happens. This is the time we need to understand. You pray, you didn't receive, because we are all praying out of point.
We're praying amiss. Giving
devil the glory should end in our generation. An Assemblies of God pastor, they went for an outreach program. While on the stage, he collapsed there, and they rushed him to hospital. And when he came, he had a hemorrhagic stroke. The whole brain was already pumped with a lot of blood. He never recovered. He died. Now, right there, his church members, we are saying that it was because of the witches in that very village where they went, gang up and shot him. If these demons we are talking about is this too powerful, why can't we go and reconcile with them and start all over again? Because if this
what will we do when we reconcile with them?
everything that we can have peace sometimes. Sometimes if we say we make we settle. We settle this thing. There are a lot of means of, when people go to court, they argue a lot in court. Over the time, they ask the judge, can we settle
out
of the court?
Out of court.
If this thing is not working on this Biden and losing Satan and the issue continue like that, can't we settle out of court? So that's not just what I'm asking.
So that at least we stop dying. All right, there's something you mentioned here, and I want to take them one by one. In fact, there are three things that we'll try and see if we can look into today and understand categorically, and that is stroke, that's high blood pressure, and heart failure. When you mentioned stroke just now, and I know quite a number of people too who don't understand maybe the signs of stroke, do not even know that this person is going to a stroke and what they must do at that time. So if you could just quickly let us know what that is.
Yeah, very interesting also to point out here, because you could hear people say the person had stroke, but it was never hypertensive.
Yes.
It was never diabetic. How come? That I must give to them, because ignorance is something that sometimes the Lord says in the days of ignorance you overlooked. All right. So when somebody said, the person slept, only for him to wake up or for her to wake up, and the left one leg paralyzed and other, how come? It's a concern. But I'm here now to demystify that very issue. That anyone listening to us, please let me just use this opportunity to call on everyone listening to us this morning. Can you join us in this Save a Life mission right now by calling anyone you know? Just ask them to tune into this station right now. Anywhere they are, pick your phone. It's more than money you will give them for hospital. It's more than the issue of money you will prepare for burial, because that is our own method of celebration, is that we don't give attention to life, we give more attention to burial. Can we just call them? Please tune into this station today, 95.1 FM. Let them be part of this that is ongoing. Please, I beg you to do it. You can say someone as I'm talking right now. Thank you for doing that. Now, let me come to that very subject of stroke. All right? That someone have issue of stroke could be what they call ischemic or hemorrhagic stroke.
Okay.
There are two types. The other one is one of more what I may call transient ischemic attack. It's more of a kind of sign God has been able to help to tell somebody, hey, something is about to happen to you. And many people miss those signs. I will tell you 5 classical signs that could happen to somebody that is about to have stroke. It doesn't just happen. As a matter of fact, stroke is originally described as cerebrovascular accident, not a disease.
Okay.
It's an accident. An accident is something that can just and it could be in position also to be prevented.
Right.
Only if you, that time they used to tell us, before you cross road, you look right.
Yeah.
You look left. After Sosoliso crash that time, they say you should also look up. Then before you cross
the
so you have to be in position to look. It's a preventable situation. Now, when it has to do with stroke, which could be ischemic. Ischemic is simply that if you look at your head, all right, your head is like a bus. And that very bus does not have any body. You can't shift anywhere because it's already come, except in the first 18 months in life, that is a neonatal. See, the head may not be fully formed. Yeah. That very space, God created that space at that early stage because it takes about 18 months after delivery for the baby to fully develop. Okay. So God created that very space.
For any expansion.
And He also created it so that when the baby is coming out, in case the place is narrow, the skull can collapse a little,
Okay.
so that the baby to come out. So it's just the purpose of that. But after that 18 months, that very anterior and posterior frontal tend to close. Nothing again. Everybody inside that brain should remain the way you are. If you are blood vessel, don't quack anybody. If you are brain tissue, don't touch anybody. So they remain like that. That is the law inside that brain. Okay?
Yeah.
And the brain has two sides. You have the one on the left. It's just like you divided the brain into two. I want you just to get a picture, and everybody listening to be able to use their mind to be understanding what I'm saying now. Their brain is just like a divided into two. The right and the left hemispheres. All right. Now, this very brain is what control everything we do. I'm talking, it's my brain that is talking. I'm moving my head, I'm moving my leg, it's the brain that is doing it. So it's just like carrying electric wires from the main distribution box. So when you move it, the right one will cross over towards the neck and supply the left side. The left one will cross over the neck and supply the right one.
Okay.
Do you understand?
Yes.
That is the reason why in a stroke case, you hardly see a stroke patient all the four limbs paralyzed. It's usually either the left,
the left
or the right. Because what will happen may happen in the right side of the brain or the left side of the brain. If it happens in the left side of the brain, it will knock off the right side, the hand, and the left. You understand that picture now?
Yeah, I get it.
Now, something happens that could affect that very brain. Number one is that the brain must receive oxygen, receive glucose. That's like food nutrients, 24/7. Anytime the brain misses oxygen, for 5 minutes, it starts dying.
Wow.
5
minutes.
minutes. By 10 minutes, the person will become vegetable. That's even if every other place is working, that brain is dead after 10 minutes. That is we will be able to discuss some of the way out of certain stroke cases, heart attack, and all those things. Okay, within that very 10 minutes, the brain is gone. So, what happened in stroke is that if there be a pebble of blood, they call it clot.
Okay.
That may fly through maybe if it's a heart that has a problem not to liquefy the blood very well, and it forms that very clot, and it flies. The vessels in the brain are tiny. It may pass through the bigger ones in the body, but if it gets to one going to the brain and block that very brain, that very vessel, every portion of that very brain where it supplies will start dying. At that point, the person will just go down. The person will not be able to speak, or the mouth will bend to one side depending on the area that is affected. And that is what happens. So that one is called ischemic stroke, which is as a result of blockage of the vessel, leading to the brain not receiving the oxygen and all the necessary things it's supposed to receive.
All right.
One. On the aspect of hemorrhagic, hemorrhagic, when you have hemo in the medical, is blood. All right. So that very type is the one that is associated with people that have high blood pressure, or people that have problems that affected the blood vessels integrity, like diabetes and all that. So what happens is that when the blood pressure start going up, the person will be having a number of wonderful signs. You have headache, and this headache, you may not be able to sleep well, and it will just taking out, just having this headache, you go and take paracetamol. All right, and the next one is all of a sudden the thing may turn to an attack. So prayer meeting will be conducted, and he will use that very brain that's supposed to be resting small under pressure and enter into night vigil. Every demon out. And the pressure will be mounting the more and the more on the already compromised brain. And if that very pressure continued, because the vessels inside are small, they may burst. So when they burst, they will now start leaking blood inside the brain, which there is no space for anyone. So anywhere that blood, compress or try to shift, either one will die. So as soon as he tries to shift anybody away, anything that one controls, he can control the speech, he can control the facial. That's why you see some people, their mouth will just be twisted to one side. One man, they rush one man, they say that the spirit slap him for dream.
Oh yes, I've heard that before. I've heard that before.
I said, what happened?
That the person's mouth shifted. They said he was slapped at night. He
was just slapped by the spirit. I said, let's go and look for the spirit first and know what you did. So, but the fact means that the two mouth, the mouth is central because there are two muscles by the side. Just like you can have elastic band holding the two equal strength by the side.
So it balances it.
Yes, if one gets weak, the other one of the other side will drag that mouth towards the area of strength. Do you understand? So that's why the mouth will go. It's what we call facial nerve problem. That's the facial nerve that controls if there's a problem with it. It could even be part of the early signs of stroke. Early signs of stroke. But they will not be in position to take care of that. So a stroke could happen as ischemic by reason of blockage. It could happen as a result of bleeding inside the brain system.
Hemorrhagic.
Whether the person is hypertensive or not hypertensive is immaterial. Stroke can happen in that very case.
All right then. So when a stroke happens, what's the first thing to do? Like you've said now, if you notice that the person is going to stroke or this, what should I do immediately?
Yeah, there's a kind of an hour, they call it golden period of mass. Because the issue of recovery is if there is a need for intervention. Number one, if it is ischemic, there's an injection that can be given to unblock that very place as quickly as possible. That person can have 100% recovery. 100%. Wow. But we never have such opportunity. Because by the time it happens, first of all, the family is in disarray, everybody is shouting. They round him up and also begin to fire the prayers as he ought to. Prayer is good, but when it is non-directional, it produces no result. All right. So, by the time they will bring the stroke patient to the hospital, it's already far gone. And they will not say, there's one place they said if you carry the person go, and the person will start walking in. No. If such has happened and taken a time, it is something of a gradual physiotherapy treatment. If the brain can recognize, because the problem is not the leg that drop, it's not the hand that drop.
It's the brain recognizing the signal.
So if the brain could be able just over the period of doing the physiotherapy, a number of facilities have been actually put in place to help in facilitating that exercise. And if he recovers it, then at that point you will not say there is hope. Are you with me? Yeah. But let anybody telling you the person has so that's one thing somebody will give him the thing. No, it's the deception of the highest order.
All right then. So we got stroke there. We'll come back to it as the questions will continue to unravel. Let's get to the issue of hypertension, because you said with the case of stroke where you said there's ischemic and hemorrhagic, that hypertension could be the case for the hemorrhagic stroke. Tell us about high blood pressure. I hear it's the silent killer. It's called the silent killer. I was reading something that said in Nigeria they've got about 1 million plus cases every year.
No. It's unfortunate as it were that is BP, high blood pressure is very, very common in our society. But the interesting thing about it is that I don't normally put so much analysis on the problem.
Let's get to the issue of hypertension, because you said with the case of stroke where you said there's ischemic and hemorrhagic, that hypertension could be the case for the hemorrhagic stroke. Tell us about high blood pressure. I hear it's the silent killer.
A lot of people under a lot of stress, the economic stress, so many things, and genetic factors. all put together, obesity and all that, could predispose somebody to having high blood pressure. All right, but the issue is a lot of people that have high blood pressure manage it very well, could live up to 90. I have a woman that is 90-year-old. She has been managing BP when she was 40 something. If she dies now, you will not say that it's blood pressure that kills him. That's why the Bible says that wisdom is profitable to give direction. But in a situation where somebody is having a BP, he ignores it. It's called silent killer, because some people, unfortunately as it were, may have their BP going up even without them feeling the symptom. That's the one that will suddenly pose out. You just either have a stroke
or you sleep and you don't wake up.
Yeah, so those are the ones that fall into that kind of category. Another thing is that high blood pressure is a systemic disease. The word is systemic in the sense that it affects all of the organs of the body. All. And where that very pressure is going to hit for us is the heart. When you keep on hitting on the heart, over the time, the heart will start getting weak. And the heart getting weak, it will not be able to pump the blood
to go around the body.
And when there is stagnancy of that very slow movement of the blood, the tendency of that blood clot we talked about, which is called embolus or thrombus or emboli, if it start flying in the blood, at that point, it could be in position to form, because if something stays for a while, over a while, they can begin to agglutinate. That's what, let me use the common language of people. They can begin to come together. Yeah. Do you understand me? Yeah. And by coming together, it could form that very clot, which can now fly to any part of the body. And if it unfortunately gets to the brain, it could be a problem. If it gets to the one we call it pulmonary embolism, the person could also fly and go from there. Most importantly, if this very person that the heart will start getting enlarged is not doing anything about it, it's just all of a sudden you will see a full-fledged man, very active, doing his work, doing his business. All of a sudden you find the person panting. If he get on a little distance, he will start panting as if he climbed a mountain. Yeah. He climbs staircase, after he climbs staircase, he will not stay. And they say that somebody just poison you, or somebody just send an attack because they promoted you in office, because you bought one Tokumbo car. Yeah. The people that now
very wicked people.
Very so very unfortunate. So when that issue of that weakness, the person will start getting, he may not even be able to sleep well again. If he sleep without a pillow, he may feel choking. Even so, that's what is called paradoxical notional dyspnea. This very one is that this very fellow will be sleeping at night. Yeah. Deep, when he's deep in sleep, he will now suddenly be as if he's dying. He will wake up and start looking for where to get fresh air. All right? This thing happens. One of my friends that had this kind of issue, when he came, he said, "Doctor, listen to me. I know when these enemies, when they used to come around 2 a.m. So what the man did is that he will sleep small around 2 a.m. He will open he will open his eyes and be waiting for
to catch them.
To catch them at that point, But what happened is that because the heart has enlarged, when he starts sleeping so deep, that big heart will now throw back over the diaphragm, so he will not have a space to be in position. So he will just wake up and he be as if there's that evil spirit is targeting him about 2 a.m.
They have come again.
So that's happening. It can affect the kidney. Hypertension and the diabetes happen to be the commonest cause of kidney failure. The commonest is in our country. Diabetes is the commonest cause. Hypertension, the brother. Obesity and all the other things that can make it worse. All right? So, All this is it can have what is called hypertensive retinopathy. It can affect the eye. It can affect all the other organs of the body. But these are the things that are manageable. These are the things that a number of things you can do, at least to be able to regulate it. Why it pains me so much is that today we have a church who has been able to take only an aspect of Christ's value. And that very aspect of Christ's value is the issue of power. But the Bible says that Jesus is the wisdom and the power of God. That very wisdom is the knowledge base, which he said, with all you can get knowledge, because it is the principal thing. And through this wisdom is what will help you navigate the issues of life. But we will abandon this knowledge. That's why God said that my people are destroyed, not because of witches and wizards, but because of lack of knowledge. And he said, because you have rejected knowledge, I have rejected you. Most people will have a problem. They will come to the hospital and the doctor will tell him, look, this is what you are suffering. He says, it's not my portion, I reject it. It is. I reject it. Is it faith? Is it God's word? It's not my portion. I reject it. Back to sender. There was one occasion I was having an issue of fibroid. I was having a conference. Just in a lady sitting in front. And I said, there being the prevalence of this in 1 out of 4 women. And I say, out of these 1, 2, 3, 4 women, one must have fibroid. One of the women became so upset. As he's sitting there, we roll his hand over the head and throw it back to sender. It's not my portion. I said, madam, don't be doing that. I'm a man. I will never have fibroid. He will just say,
well, you're not the sender. You're not even the sender.
So it is such a very unfortunate situation that we find ourselves that where wisdom should be used, our people are there binding witches and wizards. Let me tell you an interesting thing that happened some time ago.
All right.
I went into a business center some years back and they were agreeing. One person said that the sickness where they keep final, that was the era of HIV and all that. He said, but the one where they keep final, and not be HIV again. Now brief illness. My dear, relax, let me tell you. Because I confused.
He died after brief illness.
He said that's the key when they keep final and brief illness. If you hold you, he wouldn't even give you a chance, you are gone. So the other person said, no, that brief illness will hold me, I go meet my pastor. If not, that my pastor will pray for me. The other person said, if my original brief illness, before your pastor will lay hand, he already gone. And I was trying to get where is this brief illness? It happened to be in the radio and television of those days. You will hear obituary announcement that this person died from after a brief illness. So to them, brief illness
is a term for an illness.
It's a very terrible disease. It's killing everybody that announces it.
Ignorance, like you said. Ignorance. So, Doc here, what causes hypertension? What causes it?
Okay, yeah. Let's be able to look at it from a very a clear perspective. You could have what is called genetic. It runs in families.
Okay.
All right? It runs in families. So
there's just something about your system.
Yeah, it's something that is somehow acquired from that very family lineage. All right? It may be something, not that my mother and my father don't have it. It could come from
your grandparents.
Yes, grandparents, and most of them we don't have any record about them. So such could happen. Another one also, that other things that could be described as predisposing. Not that they are the cause, but predisposing factor. When you use the word predisposing, you know that if somebody is drunk and is driving, and on the course of that, he will have accident and die.
Yeah.
All right. The cause of death is road traffic accident, but the predisposing factor to the road traffic accident was the alcohol.
Yes.
You understand what I mean?
Yes.
So it will not call these ones to be the cause of the problem. Like obesity has been found to be very much in this, in smoking alcoholism, and a number of the salt intake. You know, there are men that they are secondary cook. No matter what the man cook, once you drop it, he says salt, he will just add and recook the
all over so those sweets
again. You know. And a number of such things. There are also some medications, some also exposures, stress, yes, but these are transient things that could also be managed. But by and by, it is expedient that one have routine health check.
Okay.
Routine. From time to time, when this thing is indicated at the early stage, you can apply wisdom of even exercise, which is a very good one in control of hypertension and diabetes. Exercise is fantastic, you know, but because we have to hustle now, you have to take so most of the time you have a more of sedentary lifestyle in this side of the world. You get so those factors quite emphatic to mention that they could predispose, but when whatever the issue, if it is dictated early, a lot of things can be done. Lifestyle modification, drugs are there, and a lot of things.
But it's not as if there's a cure. You're just going to have to maintain that forever.
Yeah, because it's a systemic issue, and also it's something that is activity dependent. As I came in here now, maybe if I'm relaxed talking, my BP may go down. But if I go under anxiety, the BP may go up. If I have I've not paid school fees, of course, you know, the BP,
you're stressed.
The BP will go up, you know, because most of the problem people have is just because of not being able to eat well. If you eat good food, you can forgive iniquity. so all those kind of this intend to, you know, vary the blood pressure, so it has to be controlled within the range.
All right.
You know, so that's just the thing. It's not something. But one thing, let me point out here, because that is one of the thing that they do tell us.
Yeah.
And said, must you be taking drugs all the days of your life? It's a very important thing, you know. And I will have the opportunity to tell you why most of our diabetic and hypertensive people die.
Tell us, please.
Yeah, I will tell you that as we make progress.
Okay, good.
But the issue of taking your drugs is something that the question is, this drug you are taking, is it helping you or not? The food you eat food every day, most of those food contain a number of issues also, which your body has to manage. Yet you must eat in the morning, you must eat in the afternoon, you must eat in the night, and your body is rejecting a number of them by you stooling. You pass out a number of days. Tomorrow again,
you put in more.
How come the drugs given to you, having been studied over time, that is helping to take you out of danger? And somebody will say, must you be taking the drug like food or fowl and all those kind of a thing? The fact remains that we all take tablets of granite. I used to use that as an emphasis. You now can stay here. 50 tablets of granite.
Or a bottle.
You just blow a room. The next one, 50 tablets of granite. You finish it. Why are you finishing it? In your mind, you say, it's giving me something in my body.
Yeah.
Why is your drug? By reason of what God has given understanding and knowledge to provide for you not to go into danger, you are saying no to it. Ignorance is the mother of personal destruction, a voluntary misfortune, and it is worse when you are ignorant of your ignorance. My daddy told me that a fool is not he who does not know, but he who does not know and does not know that he does not know. No be cancer with that one.
It's not cancer yet. It's heading towards there. Okay, let's get to the fire. I did say we were 3 angles. We'll come back to all the other questions that we left on the sides of all the areas we've touched now. But I want to get into heart failure. And when we're looking at it, I'm looking at issues of when you've got cardiovascular issues. There's a lot of people who will say that they haven't checked their hearts. They don't think it's important to check their hearts. If everything else is working, it's fine. But yet we hear more often than not that the people died maybe because of a certain ailment that's got to do with the heart. How important is it that we keep this vital organ under constant check? And then what do you mean by heart failure and heart attack?
Interesting. The fact is that heart failure and heart attack, even cardiac arrest, we use them
interchangeably.
Correct. We use them interchangeably in the aspect of if the person have heart attack, you don't understand what you mean by heart failure.
Heart attack.
Now, what is cardiac arrest? I will explain it here. Heart failure is not that the heart has stopped working.
Okay.
It is that the heart is not performing at its
optimal
capacity. It's just like when you have a tap that's supposed to be running with pressure, all of a sudden it's dropping, pump, and the heart's supposed to be pumping heavily, just like a pumping machine.
Okay.
And it has that capacity to pump the water that will come both because there's a big vessel called inferior vena cava that will carry all the one from the legs and take to the heart. The heart will take to the lungs, mix it with oxygen, and then come back again and keep on pumping it. All right, for everybody to receive. It has to be going very, very fast. But in a situation where that engine, that heart muscle, they are not doing well again in that contraction, that very pumping. So it will now just be pumping. Just like somebody who is already tired.
Yes.
And at that point, you see the person's leg will start getting swollen. That's what is called pitting edema. Whereby if you press the leg, you find out that it goes inside, it will not be able to come out. So that thing that is seen there is the water that the heart supposed under normal circumstances circulate, in addition to all the effects, not being able to supply the brain well, so the person will start having tiredness, dizziness, and all those things. But when it has to do with heart attack and cardiac arrest, you have a picture of a plumber and electrician. In plumbing work, you have the pipe, water flowing inside and moving. All right. And then in electrical, it gets the electric current, passing through. So the vessels of the heart, the coronary arteries, they have like pipe that blood supposed to be supplying the heart muscles. All right. But in a situation whereby there is a narrowing, just like a pipe that is blocking, so when that very blood is no longer passing through the coronary arteries, it will make the heart muscles not to receive any oxygen, not to receive it. They will start dying. So that portion of the heart will start getting whitish, and because it's getting whitish, it will not be able to initiate that contraction. So at that very point in time, the person will start having chest pain that may radiate to the. That's what I want to point out here, because many people have heart attack in this side of the world and be taking ulcer, thinking it's ulcer. The day they will go, they say that only ulcer is suffering. All right, I will tell you now, so I will explain something about that chest pain. So you will now start having that very chest pain, and from that very chest pain, it could be heaviness. It may have a common dizziness, tiredness, kind of disorientation. Some now can also collapse. All right, at that particular point in time. So the issue remains that heart attack is a plumbing work. If there's a block, that's what is called arteriosclerosis or arteriomatic plaque. It's just like when there is a deposition of fat inside the muscles, inside the blood vessels, then narrowing that very blood vessel not to flow together. So at that point, once it closes,
so that means the actual volume of blood that should flow is reduced.
Yeah, you will not be able just to go. And once there is that block, the person will have that serious problem. Then when it has to do with cardiac arrest, is inability of the heart muscles to pump suddenly because there is a spark of the electrical activity. The heart has what they call SA node. he initiates pumping on his own. Heart pumps is not under anybody's command.
Yeah.
It's God that just made it that he
Not
pumps,
even the brain?
nobody. He pumps on his own. He will initiate that very action and start. All right. But in a situation where that movement from the SNO to Purkinje fibers to the other bundles, there's a break in transmission, like in the case of what they call ventricular fibrillation, or what is called asystolic situation, or what is called a pulseless electrical activity, or the one is called pulseless ventricular tachycardia. These are 4 different types of heart attack, cardiac arrest. So it's the response will also, by doctor getting to understand somebody, will also determine the kind of attention or emergency response that can be given to that very patient when it happens. So it's more of electrical, why the heart attack is plumbing, why the other one is because of weakness of the heart, not to be able to perform.
That's the heart failure.
Yeah.
And on all of this, like, except the cardiac arrest, what I understand is of an electrical issue. The heart attack, the heart failure, all this, could this be linked in any form to diabetes and high blood pressure?
Of course, the high blood pressure predisposed to 3 of them.
Wow.
Diabetes can predispose to 3 of them because also it affect the activities. You know, when I use the word diabetes, is a systemic problem. Systemic in the sense that it affects everybody. Everybody needs glucose.
Oh, yes.
But excess of the glucose suffocates. It causes neuropathy, damage to the nerves. That's why most men, somebody may have diabetes, it will be as if it's marching on pin. And sometimes you touch that particular the toes or the hands
or the
may
fingers.
not be having any sensation. Before I entered medical school as a young boy, there happened to be one man. I was observing this man. He was walking in the village. His slippers pulled out. The man was still walking. And I was so surprised. What could have happened to this man? As he was moving, he hit his leg against his and started bleeding. He didn't feel it. So he walked. And I asked one old man in my village that time that I saw this man, because they thought him to be an evil man. So I said, I saw this man, his slippers pulled out. The man said, he rebuked me. I said, did you say anything? I said, no. He said you shouldn't, that the gods must have been after him. You understand that? So I have that mindset. When the man died, as a small boy, when they gathered him, I was so weird looking at that his leg that I saw that time. So when I entered medical school, and I got to know that man must have had diabetic neuropathy.
And so he had no sensation.
He had no sensation. The same no sensation he also will happen to a man who had diabetes. This man who won't perform. And that's one of them that the wife, was accusing him of going out. And I don't know, the wife say, this your journey, you will not return well. And when he started having diabetes, the man who wasn't performing, he came back to the house causing problems. Said, woman, you have done your worst, I know. You have done it.
The simple life explained by medicine. Okay. I think that one of the greatest challenges to medical health here in Nigeria will be, detecting these things early and understanding what they are. But I think the challenge lots of Nigerians will face, and I'm speaking for quite a number of them, is getting the right equipment to diagnose some of these things, to see this. I mean, I was wondering when you were calling all the names now, I was going to ask you, how do you even know all the names of this? You're breaking it down. But I think that, part of the problem also has been that you get to the hospital and they have the right equipment to check this, to see that, okay, you mentioned something about the stroke, and you said if it's this one or that one, you need equipment that can also tell you what kind of stroke you're dealing with and what kind of medication that you should offer. the biggest challenge, honestly, has been the right equipment to determining this for Nigerians. What are we doing against that? What are we doing to fix that?
I must also admit, the deficiency in terms of facility. Just like now in this side of the world, as I looked at in the recent time, if somebody has aortic aneurysm in this country, he's dead.
What's that one now?
My big grammar, leave it for next time. If somebody has that, if there's a ballooning of the blood vessel,
okay,
aneurysm, all right. If there be such a thing, the person is gone. If there be a cardiac arrest or heart attack, the person is seems as if no limited and no opportunity. It's part of the thing that I must have to at this particular point in time, because following COVID, the CBN, was able to come up with intervention fund, which has been able to help in equipping a number of hospitals currently in Nigeria. So that's how through Access Bank and the CBN we're able to acquire a cath lab right now. Cath lab is that equipment that perform angiogram, angioplasty, and all those extreme technology in terms of if there's a blockage in the artery, it can be opened up. Okay.
Oh, it can not just see it; it can open it up.
It can open it up and now make it not to collapse or block again. So you can do a lot of valvular replacements and all that. It's a good thing at least that we have one now in the whole south. All right.
Fantastic. So you said this was done through CBN and
CBN
initiative.
Initiative, but also my bank, Access Bank.
Okay.
They funded is almost 900 million. So on that particular accord, some of these also in a number of hospitals now in Rivers State, even Yeso we must commend. Not less, a lot of things go on politics, policy, which I'm not interested in. He has been able just to put a lot of things. If you go to BMH, it's an interesting thing, the kind of MRI they even put there. You get to there, you see a number of things that have been put in place. But unfortunately, people are not even aware that most of these things are in the hospitals. All right? And most of the hospitals, because if you don't even know, thinking it's an attack, how will you be in position to go to the hospital
to get the right
early in
detection?
Yes, intervention.
Intervention now.
Yeah. So if you get a number of centers, I must comment that in Nigeria currently, following this issue of COVID, there's a remarkable improvement in the facilities of most hospitals.
The kind of equipment they have. Now, again, I'll say something. There was, I think, during the course of my presentations of the week, I had a conversation with somebody here in the studio, and they mentioned how they went somewhere for a check. They had an issue, and I think it was MRI, and I can't remember, that they had here. Somehow they couldn't read the results. There was something wrong. They kept saying, "Oh, the equipment is faulty. This is how we have to hold it like this or do like this." That the only place he could get one was to go to Abuja. So he left for Abuja, and he did it. Now the results cannot be interpreted. They've been trying to do the different things to interpret it. So I'm wondering the technicality that comes along with some of these equipments. How prepared are we?
Yeah, we had a stakeholders meeting in Abuja, and I was able to put them very clear to everyone. It is not a function of buying medical equipment. When looking at the issue of the cath lab we have purchased now, the fact is that it is not only about buying such an equipment. But our own problem is that most of the equipment they buy, particularly in our federal government establishments, happen to be contract based.
What do you mean by that?
Good. The contract dimension of it is that a meeting will be held. No, we need MRI, we need CT scan, we need this other one. And then a contractor will quote. We go out there, even if we find any refurbished equipment or anyone, he will bring in the doctors that will operate on this equipment, or the people that will operate on this. They won't be carried along at all. Even now in the area of cardiology, most of our cardiologists have little understanding of cath lab and most of those cardiac intervention. Some of them have gone abroad to be bought. They will not be carried along. So now, assuming that you need a Siemens product or this other one, or this man went outside and trained on a Rangers, for instance, only for him to come back with that very one, the knowledge he has, then somebody will go and buy a different brand. What you have kept there, once himself who train with another device, once he touches it, is to send it to early grave. You understand me? And that's one small time they say that something has spoiled and the other one has spoiled. So it is a model that we actually try to work around that. Before we get any equipment, we make a provision for the training. There was a time I took some doctors from BMH and UPTH. I sent them abroad I funded it for them to learn laparoscopy.
Okay.
Somebody said, why are you doing that? What if they don't work for you? It's not a function of working for me. When they go train and come back, they can help even to sustain, knowing what to do. If they are to do anything for you or they are to do on their own, they could also know how to be in position to manage it. But in a situation where the doctors are not carrying along, the paramedics are supposed to be involved in those exercises, not carrying along, then you bring equipment. Sustainability will be a very, very serious problem. So I always recommend that first of all, let these people train the manpower first. When you train the manpower, then you get the equipment. Hands-on, they can now begin to learn. And when you go train somebody, no equipment, when he comes back, everything he learned will be deleted. The day you now bring the equipment,
he's relearning again.
He's relearning again with it. So all these things are some of the things that should be strategically. I've done a business in medicine where I have to get some of the equipment we have, and I sign a contract with them, 5 years. And this 5 years is transfer of technology. That you people will manage this equipment. While you are managing it, my people will be working with you until 5 years. Yes. You will not leave this equipment with me until 5 years. So before 5 years, the localites are already getting to
familiarize themselves with it and understand the machine.
So it's unfortunate, but hopefully things will.
So this cath lab, what actually does it do? The cath lab.
Yeah, that is the ultimate machine that if it's not available in a country, that very country will suffer. Majority of the sudden deaths we are talking about is what it could be able to reverse. If there be a blockage of the vessel. All right. And that very person, you meet that very person at that time of my cardiac infarction or this, and once you get it done, it will show you where the block is. It doesn't need to cut the body open. That's why I said technology is advancing right now. Through the femoral vein or even through the radial artery, femoral artery or the radial artery, you can go all the way into the heart and unblock it. And you can put a stent, that plate that collapse, you can put something that will expand it so that the blood flow will come back again. If there be a valvular problem, the valve can be replaced. If there be the heart failure, the person is not working.
You replace a valve while the heart is still functioning?
Yes, you replace it. You can do a valvular replacement right here. You could also be in position to put up a pacemaker. A pacemaker is that if the heart is not pumping well, that pacemaker helps you to be pumping, thereby circulating the blood well. If the person continues in that low heart performance, over the time he will have a heart attack or he may have a cardiac arrest. So it is still something that a lot of things, a lot of interventions can be done. That's why I can say today there's a very big hope for the country.
All right then. So with the cath lab in board now, we can start putting a lot of salt in our food. We know that it will be we know where to go to now. Okay, but let me get to the point here where I earlier mentioned about early detection, because it is key to all of these things you've said here, to diabetes, to high blood pressure, to whatever issues you might have with the cardiovascular area of your body. With early detection here, how early would you say someone should start doing their yearly routine? At what age would you say you must have that?
Yeah, the issue is that most of the things you said, okay, for kids, but at least you should have your medical record that by the so and so time that my body system is like this, so that when you start getting deranged, you could be able to also
tell
again, oh, come on, it was this before now, but
this is where it's going to.
Something is going wrong. I've never been feeling this thing. That's why they do early detection of cancer.
Yes.
Yeah, from just a simple as a matter of fact, early detection of any disease, including cancer, is as good as prevention. Most cancers can be cured. Prostate cancer can be cured. Cervical cancers can be cured. So all this thing is something like once one reaches an adult age, even just routinely, even just and the one you start getting older, you do it from time to time. Spend that money. It is like servicing a car.
Yes.
After 5,000 kilometers, the car will show you red. Go and service me. Go and service me. Something is going wrong. You go and do that. Most of us can spend money, service our car. But when it comes to our health, we pray.
We'll find anointing oil somewhere. I mean, there's an anointing oil somewhere that can work. Okay, so I got that. Routinely is early, is part of what you prescribe for early detection. Thank you so much. But is there anything you want to share with the people just before we let you go?
Yeah, just like I rightly said, it's a mission. And it's a mission everyone should be part of it. What you have gotten today, share it to someone. Use it for yourself, use it for your family, and believe in the fact that there should be a better country we have as our own. And I keep on telling people, let's always be this solution minded, not just analyzing problem upon problem upon problem.
Solution?
Let us begin to think. Nigeria is very rich. I keep telling all the even some of my staff in US, while I said, come down to Nigeria, they are Americans, but they want to also come here. Because there are a lot of problems in this Nigeria, which made Nigeria very rich. If you solve the problem, you become a billionaire. You understand? So people should begin to look at solution-oriented attention, not just the one of analyzing or trying just to make it as if there's no hope for this country.
Fantastic.